Dr. Kavanagh, would you please tell us a little bit about the history of this lower tooth?
Age 7, Christmas Eve, my tooth was knocked out with a plastic toy. Of course, my parents, in their loving way, put aspirin on it, so I was in a lot of pain. Saw my dentist, who put in a temporary crown, which I used after a root canal. I probably used that on and off throughout my college days. During my college period, knocked the crown off again. Then a silver pin was put in, probably age 20, 21, and then I proceeded to attend professional school, and the University of Iowa College of Dentistry had many attempts at replacing that crown that was never able to stay in because it seemed like the crown was too small, and being in the front was always knocked out, with my bite. Although I don't look like I limited what I ate a lot of soft foods, my quality of life was decreased. Prior to my marriage, though, my father made a deal with my fiance that he'd fix it one more time, and I had a silver pin put in that lasted almost 20 years. And the silver pin seemed to provide a more stable crown, and maybe it was technology, but this was not a plastic crown. It seemed to be made of ceramic and actually had metal. So I knew the metal was starting to wear off about 10 years after that was placed. It was real ugly, and my primary care dentist wanted to, update it, make it more pleasing, and I just resisted because I'd had so much trouble with the crown. And then the fateful day in Montreal when I'm eating a piece of French bread, and the crown comes out with the bread, and also a very terrible smell, which must have been a gram-negative or some sort of nasty bacteria that was in my crown, which had been loose. So I came to see my primary care dentist, and he referred me to Dr. Kasaba. And at that time, I was fearful of another pin and the long process and the trial and error, and he suggested the mini implant. And I think there might have only been a couple visits. The first visit was about cleaning out the infection. I was on antibiotic for a few days or maybe a couple weeks. Then the transplant or the implant of bone graft, and that was no big deal. It was injected, no pain really, and I think I waited maybe 3 or 4 months for that to take effect, and came back in March. Must have been 2006. Excuse me, it's probably 2005. And at that time, the implant was put in. I couldn't believe he could put a little small, it looked like a nail to me in my sore area, but it didn't hurt. It was well anesthetized, and although there was a lot of pressure when you put the pin in, it seemed like it took. I had a temporary crown put on, and then saw my primary care dentist again to get a ceramic crown put on. And now, 5 years later, I eat apples and have had no trouble. I never would floss before, which made me worried about my gingiva, but now I just go at it with my floss without any problem. I feel like my gum is healthier. There was some discoloration prior to the last crown, so probably between 2000 and 2004, I don't feel like my gums were very healthy. They would bleed, and around that area it was very tender. But now I feel like I floss without any bleeding, brushing, no problem, and I just feel like I have a healthier mouth.
Thank you very much for your comments.